Who shapes pediatric policy? In 2023, California, Oregon, Washington, and Hawaii formed the West Coast Health Alliance, WCHA, a coalition designed to coordinate public health policy across state lines. The alliance was created in response to concerns about the politicization of federal health guidance, particularly from the Centers for Disease Control and Prevention, CDC. Its stated mission is to provide unified, evidence-based recommendations for residents, with a focus on transparency, safety, and scientific integrity. Rather than relying solely on federal agencies, the WCHA aligns its health policies with recommendations from national medical organizations, including the American Academy of Pediatrics, AAP. This shift towards state-led coordination raises important questions about how pediatric policy is shaped, who influences it, and what frameworks guide its development. The American Academy of Pediatrics was founded in 1930, and today represents more than 67,000 pediatricians and pediatric subspecialists. It publishes clinical guidelines, vaccine schedules, and policy statements that influence pediatric care across the United States. The AAP's materials are widely used by healthcare providers, school systems, and insurance companies to determine best practices in child health. To understand the foundation of the AAP's approach, it's important to look back at the Flexner Report. Published in 1910, the Flexner Report restructured American medical education by promoting a standardized curriculum rooted in laboratory science and pharmaceutical intervention. This reform led to the closure of many community-based and culturally rooted medical schools, including institutions focused on homeopathy, naturopathy, and traditional healing practices. The report centralized medical authority in elite institutions and established a biomedical model that continues to shape clinical education and practice today. Pediatricians trained in Flexner-influenced institutions often become members of the AAP. Membership includes access to continuing education, policy development opportunities, and professional resources. Members pay annual dues, which help fund the organization's operations, including its advocacy for standardized care and immunization schedules. These dues also support the AAP's infrastructure, including its committees, publications, and conferences. In addition to member contributions, the AAP receives funding from government grants and corporate sponsorships. Federal agencies such as the Health Resources and Services Administration, HRSA, have supported AAP initiatives focused on children with special healthcare needs. Corporate sponsors have included pharmaceutical and medical device companies such as Pfizer, Merck, Sanofi, Johnson & Johnson, Abbott, MedImmune, GlaxoSmithKline, and AstraZeneca. These companies have supported AAP conferences, educational programs, and pediatric research efforts. The AAP maintains internal conflict of interest policies and discloses sponsorships through its chapters and publications. The AAP's guidelines are based on clinical research and expert consensus. These guidelines are adopted by pediatricians, health departments, and school systems across the country. In WCHA member states, these recommendations are used to inform vaccine schedules, school immunization requirements, insurance coverage policies, and public health messaging. The Alliance's decision to follow AAP guidance reflects a commitment to consistency and scientific rigor, but it also highlights the importance of understanding how these recommendations are developed and funded. Medical professionals trained in standardized institutions contribute to AAP policy development and help implement care protocols in clinical and public health settings. The integration of AAP guidance into WCHA policy creates a streamlined framework for pediatric care across California, Oregon, Washington, and Hawaii. This framework supports uniform vaccine schedules and preventive health measures based on established medical standards. Understanding how pediatric policy is shaped through historical reforms, professional organizations, funding sources, and educational pathways can help families and caregivers make informed decisions. It also provides insight into how state-level health alliances like WCHA coordinate their recommendations and implement public health strategies. Follow for more videos like this.